find the tasks to complete for today. This is Unit 2, Lesson 5. So you're looking for tasks to complete for U2L5. Again, you can either look under assignments on the Disease and Health homepage or go to the weekly calendar right there just by scrolling down and finding today's date. As we've been doing, is some homework review. I have gotten the patient zero quiz. Everyone has submitted it. I am missing pictures of the modeling and outbreak from a few of you, specifically Iva, Jackson, Bella, and Rory. So submit those if you haven't done so yet, or let me know if you need help figuring that out. But that's just like the last step. You just had to submit a photo just to show that you did the activity. And then there was the reading reflection about R0 and contact tracing, which was super short. So anyone know what disease, what pathogen has the highest R0 value? I thought it was kind of surprising.
Measles.
Yeah, it's measles. And yet, why aren't we seeing like annual outbreaks of measles like we see with the flu? Does anyone know what's, I think it's like 86% of people are what?
We got like vaccines and stuff.
Yeah, we have a pretty effective vaccine. And I guess too that measles doesn't mutate at the rate that you see things like the flu. The reason we get the flu annually is because, yeah, we have a vaccine, but we get a new version of the flu every year. So, Jackson?
I had a question about, I kind of don't have all the cups again. Like if I was to submit that assignment, you want me to just like fill it?
You just forgot to take a picture?
Yeah, I just didn't take a picture.
Yeah, that's okay. Just let me know. That's all right. If you've done the contact tracing, like as long as you have the data, then that's fine. Then
the rest of it's done.
Cool. Yeah. Okay. Yeah. So if you forgot to take a picture, any of you don't worry about it. You don't have to like set it up again. I'll just look at your data. That shows that you did it. So cool. Any other questions or comments from those assignments? Contact tracing, patient zero, or the short reading reflection. All right, then this is the big reveal. I have collected the patient zero data from your partners and classmates, and I tried to partner up everybody. So there are the original numbers. You should be right next to the person you were partnered with. So take a look. The only one, Iva, do you remember what your original infected number was? You're the only one I'm missing.
Yeah, mine was patient 1.
Awesome. Number 1. All righty. So, and you, I think you can open this as well from the sheet. So were most of you pretty close? Did you get that number at least in your final 2? All right. It's possible sometimes to be thrown off, especially if there's like a lot of like overlapping or double exposures in your data. That's what I found in kind of giving this a try. What did you think overall? Like, was it kind of difficult? Was it easy? Do you find yourself getting frustrated or had a good system? Zach, what was it like for you?
It was fine. I mean, okay. Bella accidentally put 2 3s and no number 4 in her second round. So I spent like 20 minutes trying to figure that out. But then she fixed it, and it was pretty easy after that.
No, that's pretty good. And it's a good example. I mean, do you think there are sometimes errors in contact tracing data in reality? There totally are. And especially when you're doing something like this, it can really throw things off, and it requires a lot of extra effort and time. So that's kind of a good demonstration of that. Margot, what do you think of the experience?
I liked the reasoning I had to use, when finding my partner's patient zero. I just enjoy thinking that way.
So can you all imagine doing this with something that had an R0 of like 6, where you have to take into account 6 different people? I don't know how they do it. But I mean, and as far as I know, they aren't usually able to narrow it down to like, here's the one person where it originated. That is pretty much next to impossible. But they do narrow things down to usually a location or region, or, if you've been reading about COVID-19, like a marketplace, like we know it started here in this market, because that's where we started seeing these first people. So it's pretty nuts when you think about the math. And if you like puzzles, this is the kind of thing you could get into and do research in. What I find interesting too is not necessarily looking at like the origin of where disease first appeared in humans, but there's a lot of effort put into who brought a disease to a new continent, right? Because we have a lot of data on things like immigration records and stuff. And so it has been interesting that they've been able to sort of trace some of that back too, to be like, well, who was the first person, or what ship was it that brought certain people in that had a certain disease? And they can usually then trace that back to where it came from, and where the ship had picked up certain people. And anyway, I find stuff like that kind of interesting. So all right, so we're not going to do much more with contact tracing. Today, I want to expand and focus in on COVID-19 in particular, building off of this idea of R0 and how diseases spread, so compare COVID-19 to other diseases, and just get into some detail about what's going on with coronavirus in particular. The first thing we're going to do is you're going to be working together sort of Poggle style, if you guys ever did Poggles with me in the past, to read through an article online from the Washington Post. It's titled How Pandemics Like COVID-19 End. And then you're going to work together to fill in a Google form. And so I'm going to throw you into random breakout rooms again with a partner. One of you needs to take on the role of a reader, which you're just going to be reading the article out loud so that your partner can hear you. And just go paragraph by paragraph. You might pause to answer a question, and then you can continue reading. The scribe is the other partner, and they're going to be looking at the questions on the Google form, and you can pause the reader every time it looks like you've hit a relevant section for a question. Answer the question together. Again, only the scribe is actually typing or selecting the answers though, so I only need one Google form for each pair of you. And then you can have the reader keep going. So again, you're kind of working through this together, and that's a kind of give you roles that'll help you through that. So links to all of this are on step 4 on the tasks to complete list. I'll share my screen here really.
You're muted, Mr. Hay.
Oh man, did you guys not hear any of that? All right, well, Jonathan, I appreciate you speaking up after a few minutes of me blabbing. Oh man, sorry kids. That's the first time that's happened in a while. Okay, my bad. So we are moving on to focus on COVID-19 and some of the details around that. Looking at step number 4 on the tasks to complete list. You're going to be working with a partner to read an article and answer questions on a Google form. So I'm going to throw you into random breakout rooms. And the article is a bit unusual. I'm going to share my screen here.
You're muted again.
You're muted again.
When you share your screen, you get muted.
Oh, okay. Weird. What's going on with that? Anyway, all right. I assume looks like I'm good now. So it's you'll see these are sort of a simulation of the spread or outbreak of a disease. And what you just need to do is scroll through. You'll get these sort of windows of text, and that's the article. So kind of just read through each of those and keep going. And it'll be pretty clear where you have questions that you can answer on the Google form itself. Here's the Google form. Here's the Google form right here. There's a link to the article on the form as well. So it's about 10 questions or so, I think, for you to answer, some multiple choice, some free response. So work together. Again, scribe should be answering the questions, and the reader should be reading through the article, and then you're pausing and working together to answer those. I'll drop into the your breakout rooms every now and then just to check on how things are going and see if you have any questions. All right, it didn't mute me when I exited, so that's weird. All right, any questions on what we're doing? All right, I'm going to recreate the breakout rooms. And we'll time for 20 minutes to get through this, but again, I'll kind of check in and see how we're all doing. Breakout rooms are open, go for it. Well, I hope that was somewhat informative. Let's go ahead and take a look at what kind of consensus we came to on some of these questions. First one, it's kind of funny reading this article written back in February where the number was at 200,000 cases, and I remember hitting that point and being shocked by it. But yes, it looks like everyone got that. We are now globally at about 38 million, headed towards 39 million. That's cases, not deaths. Does anyone know, though, what unfortunate milestone we also reached with deaths?
Wasn't it like 5 million?
I think it's over 1 million deaths, right? but again, they're predicting that if the things continue that way too, we're going to be on our way to 2 million in not too long, which is not a good thing. Especially, I don't know if anyone's been watching the news, but there's now a resurgence occurring in Europe. So it's just incredible how it's grown since then, just with the cases. So yes, an R naught of 2.3, very good. You're understanding that R naught is just a measure of, on average, how many other people get infected. And in this article, they're just arbitrarily assigning that, right? So they created this simulation using a computer program. And so they're just entering that as a number for that animation to play through. It's not actually based on any real data other than that COVID-19 has an R naught of about 2 to 6, so they go with 2. So what assumptions do they make? Very good. All of you got that it is all of those things, right? Which again, it's not the most realistic. Like any simulation is going to be limited because they're assuming that everyone's susceptible. There's no masks and no quarantine happening and no vaccinations. And so most diseases, we have a vaccination, or there's usually people who are immune in the population, something like that, which would alter the results a bit. So very good. What's going on with the other 505 people? It's that they weren't exposed. So we can assume they didn't get sick. They either got lucky, they were living in remote places, or I mean, it's possible that maybe you've got some immunity going on, but they didn't set that up to be that way. I think it was literally just a roll of the dice for those people. If you can't get reinfected, very good. Everyone's understanding that it's all about getting that RE value less than 1. That is how pandemics end, is when there's less than 1 person available to be infected by people who are already sick. And so it's sort of that idea of like pandemics are going to fizzle out eventually, right? They eventually have infected everybody. The one problem is that there are some pathogens, in fact, most pathogens will mutate. And so they are able to reinfect people who have had it before. And they are now, unfortunately, starting to document that with COVID-19. People who have recovered are turning up with it again, and it's often a more severe form. So they're starting to focus on that a lot now in different studies. Yeah, measles is nuts, and we went over this in the Do Now, really high, but we vaccinate for it. And measles just doesn't mutate, I guess. We don't usually see a new form of it. So, or the vaccine's effective against most existing forms. Ebola has an R naught of 2 or less. Don't think of that R naught value as like the measuring the lethalness, right? Because that's R naught is just the spread. As you can probably see from the death rate, and a lot of you noted, Ebola kills half of the people that it infects, which is scary, or higher. I think if you look at the percent death that I had calculated on there, it was about just shy of 50%. Yep, 49.3%. Which is pretty nuts. But again, also is one of those things that prevents it from becoming a pandemic, because it's usually killing people so quickly and so effectively, it doesn't spread very well. And then you looked at the PPE, and the key takeaway from this is that, very good, using the equipment, it takes longer for the disease to spread through the 4,000 people, but it lowered the number of recovered and it lowered the number of dead, meaning that it had decreased exposures in general. Now, Margot brought up a really good point, though, about how the R naught is still 2.4 here. And it's kind of a good question, because we had defined R naught as the average number of people that get infected, but yet with PPE, we're lowering that number, hopefully. But again, I think it's just that they were arbitrarily assigning this. That's what they started with, and then they introduced this idea of protective equipment like masks and gloves. But you can see that masks and gloves are effective at reducing numbers of exposures and deaths. But what I found really interesting with this is that it increases the time. It took longer, right? It lengthened how long the outbreak was taking place, which seems counterintuitive, right? Why would you want a pandemic to last a long time? But it's actually a good thing, because you don't want to overwhelm your medical providers, right? Hospitals, medical workers. If you have a very rapid spread, they're going to get totally overwhelmed. The whole point is to, like they say, flatten the curve, slow things down so that you're not overwhelming the medical system to treat people who really need it. And then looking at the quarantine was obviously, like, this had such a drastic effect. It shortened the amount of time. It drastically reduced the number of exposures, recovered deaths. Quarantine is definitely like very, very effective. But as you got with that last question, and a lot of you are getting it, quarantining effectively, like they assume in this simulation a perfect quarantine right after like the first 2 cases pop up, which rarely happens. Most of the time, once we become aware of a pandemic, it's already at the pandemic level. And quarantining then gets super, super tricky when it's already in different parts of the world. And it's really hard to control human movement, especially in this modern day and age with airplanes and kind of the globalization of trade. It gets really hard to kind of contain things. So good observations. Looks like you took those. Those were kind of the key takeaways from that. Questions or comments on the article? All right. Some of you might have already then gotten going on the next thing, but I wanted to give you an ed puzzle on coronavirus and get into some more of the specifics of what it is, and you'll be reading about that tonight as well. So I have an 8-minute ed puzzle that has about 10 questions to it. So I'm going to time for about 12 minutes to work through it, and then we'll come back together to review. And the link is right there on the tasks to complete list, step number 5. Let me know if you have questions. If you can't get Edpuzzle to work, on the assignment, I have a link to just the YouTube video too. So if Edpuzzle isn't working for you for some reason, I know it like freezes sometimes, then you can just watch the YouTube video. So 12 minutes to work on that, and then we'll come back together. But I can see your progress too, so if I see people are finishing, we'll just come back together a little bit sooner. Video and fun animations. The whole animation of like the person with the virus on their hands and then like touching their nose and eye, to me was just like, oh, but it's a good demonstration of what's going on. Okay, so let's take a look. I can break down the specific questions here. First one was pretty obvious, and all of you got it, that the way that COVID-19 spreads is through droplets that can either be in the air or on surfaces. This is why it is recommended that you wear masks and wash your hands frequently, right? Because we're avoiding getting viral infected particles on your hands or breathing them in, especially while you're interacting with people. And that's why they also have that 6-foot distance thing, is they think that droplets you're unlikely to be exposed to those as long as you're staying 6 feet away from most other people. So what do viruses do when they're inside the cell? It is that they hijack all the machinery to make more copies. That's the weird thing about viruses, is that they can't duplicate themselves just on their own. They have to use the ribosomes and endoplasmic reticulum inside of cells, and that's what they do when they infect it, and they completely destroy the cell in the process, also just to be released into the body. The COVID-19, I know a lot of you think of your lungs, and that is what it is infecting, but it's sort of weird to think that the ailments and a lot of the problem actually come from your immune response to the presence of the virus, right? The immune system goes into total overdrive. The disease starts to infect immune cells, and so it's sort of like an innocent bystander situation where, and I think that's what the next question was getting at, your immune system starts to destroy infected cells inside your lungs, but it's also destroying healthy cells because it can't discriminate at that point. And so your lung tissue becomes damaged, and the specific alveoli in your lungs where gas exchange is supposed to occur, they'll fill up with liquid, it swells, so you're not getting enough oxygen to the rest of your system. You're experiencing respiratory failure, and that's the primary cause of death. You're also then exposed to or vulnerable to other infections, and that's kind of the other thing. I think we referred to super infection before, but even if you're overcoming the virus, if you're then suddenly exposed to like a bacteria that normally wouldn't be a big deal, your immune system would have killed it off. Now your immune system's weakened or preoccupied, and so you're more vulnerable to other bacterial infections that could also take you out or cause pneumonia, which is the liquid inside your lungs. So resources needed for severe cases, it is indeed hospital care, but most importantly, they don't mention it here, but ventilators, which are these pretty complicated machines that force you to breathe and fill your lungs up. And those are needed, and they're not in a huge abundance in hospitals. So this is why a fast pandemic is a bad thing, because it forces hospitals into what's called triage, which is really not a good situation, where you're basically trying to decide who lives and who dies based purely on availability of beds and availability of machines to help these people. And so it seems counterintuitive to make a pandemic last longer, but the more you can do that, the more you can get slow down the spread. It allows hospitals and medical workers to treat everyone and save lives more often. And so everyone got this too, that it's all about avoid being infected, obviously, and consequently from that, avoid infecting others. And so that kind of gets back to that contact tracing handout that you read as well, where it's important to, if you test positive, to immediately call your the local health management, and they will take care of everything, right? They will do the contact tracing for who you could have potentially exposed, who you got it from. The point is to lock it down, right? Avoid infecting others and avoid having them infect more people too. Washing your hands, I thought this was kind of interesting, of just, it so completely destroys these fat-based viruses that have this sort of membranous outer coating, but also literally just washes them off your hands. It's weird to think, but you saw in that contagion scene, you're touching your face 3 to 5 times every waking minute, which seems crazy, but that's what we do. And so the more you can keep your hands clean, you'll avoid that potential transmission of infected droplets. And so social distancing sucks. We're all kind of got quarantine fatigue now at this point, but it's one of the important things to do. And it includes staying home, not interacting, no handshakes. It's going to be interesting to see how culture kind of changes in response to this more slow spreading virus that we're now going through in this pandemic. But that's the overall message, is to kind of slow the rate of spread. So looks like we're feeling good on that. Any questions or comments on that video or on coronavirus? I didn't notice we'd gone over time. I apologize for that. Homework is just a short reading from Gladwin. I have a scan of it right there. Usual deal, just submit a photo of your notes and work on a short reading quiz. I'll hang around if anyone has any specific questions. William, if you don't mind, I'd like to check in with you real quick. Otherwise, thank you very much, everybody. Have a good day.